according to the Lancet report, approximately 200 million people in India are affected by mental health disorders. Now, the healthcare services reach a very small minority of these people who require services. One of the biggest problems which India faces is what we may refer to as a lack of mental health literacy. People do not understand the symptoms of psychological disorders. They do not understand that there are effective treatments available for psychological disorders, and also that these treatments are extremely effective. There is a lot of stigma which is related to mental health disorders. People feel that going to a psychiatrist or a psychologist almost equates to being mad. They do not realize that most of the psychological disorders, which we refer to as common psychological disorders, occur in people who are otherwise as normal as anybody else. So stigma plays a significant role in delaying contact of people with mental health services. Then there is problem of education, there is problem of infrastructure. So there are very few psychiatrists, only a few thousand psychiatrists available across the country, and that number has unfortunately not been increasing significantly. The number of psychologists are also few. Hospitals which provide mental health services are also lesser in number. So the infrastructure available for treating people with psychological disorders is also less. Apart from that, a push from the government, policies related to people who have psychological disorders or may have psychological disorders, the policy and the push from the government as well as the budgeting which is required for mental health needs to be much more. So there is a lot of things which we can do on a day-to-day basis in improving our mental health. Now, even before that, I'd like to highlight the definition of health itself. The WHO way back in 1948 mentioned that health is about physical, psychological and social well-being. So it's a state of physical, psychological and social well-being and not merely the absence of disease. So psychological well-being needs to be present in order for us to call ourselves healthy. The little things which we can do in order to improve our mental health is to begin with, let's say, lifestyle changes. Something as basic as sleep and a healthy diet. Adequate hours of sleep are very important for good mental health as well as functioning. People who are sleep deprived often tend to be irritable, anxious or even depressed. So something as basic as sleep is very important. A healthy diet goes a long way in restoring physical as well as mental health. Then for people, we must realize that getting up in the morning and going for a morning walk or some sort of exercise is believed to be a mood elevator. It elevates our mood, it improves our energy levels, improves our attention, concentration, memory, all of that. So exercise itself is a mood elevator and it also facilitates better sleep. So that's very important. People can learn any one of the simple meditation techniques, and meditation techniques are very effective in calming down anxiety, bringing down blood pressure, reducing the heart rate, reducing anxiety, and again facilitating better sleep. Meaningful engagement is very important. Now, we need to be engaged in something or the other throughout the day in order for us to stay mentally healthy. We need to have positive involvements or hobbies in place, things which relax our mind. It could be music for somebody, it could be creative arts for another person, it could be gardening or cooking for another person. So we must spend some time in our hobbies every day. Unfortunately, work occupies too much of our daily lives and impairs our involvement in other activities. So hobbies are very important. And then something which has been talked about repeatedly, particularly during the times of the pandemic, is social connectedness. Talk to people. So social connectedness and ventilation, which we refer to as sharing your thoughts and feelings, are extremely important. So make sure that you have a good network of family, of friends, of people whom you can talk to, as well as you are constantly in touch with. It would be better to give a phone call to somebody or do a video call to somebody or go and meet in person if the pandemic now receding, if that permits. Invest time in your relationships. So what we've seen during and after the pandemic is that mental health disorders have increased. There's a lot of increase in anxiety disorders, depressive disorders. A lot of grief has been, experienced by people, and it wouldn't be unfair to say that along with the COVID pandemic, a mental health pandemic is also simultaneously existing. So what needs to be done at this particular point of time is, the most important thing, I guess, would be awareness, raising the levels of awareness of people, making them aware that some of the problems that they are going through, there is help available. For example, somebody who's had a financial loss or shutting down of his business during the pandemic and feels depressed does not come to a mental health professional thinking that depression is a natural consequence of the situation that he is facing in life. Whereas the truth is that we may not be able to help him with his financial position, but we can help him with his depression. So raising awareness about symptoms of psychological disorders, the fact that treatments are available, that's very, very important, and there has to be a strong push from everybody in this direction. Also, some of the myths and misconceptions related to mental health should be handled. People should be explained that it's not a big deal going for a consultation to a psychologist or a psychiatrist. Just as you take care of your body, you should take care of your mind as well. So the myths and misconceptions should be removed, the stigma should be removed, and where all mental health services are available and accessible, that also has to be provided. People often do not know where to go to, and at this particular point of time, a push towards teleconsultation services will help the population at all, particularly those in the remote area who actually have no access to services. During the COVID pandemic, the central government as well as the state government came up with telecounseling services, and there were helpline numbers available for people, and these telecounseling services were free. Now, what we need to understand is that yes, telecounseling services are being provided by the government for free, and they are also being provided by the private hospitals as well. We do not know the utilization of these telecounseling services, but telecounseling services are quite effective for majority of the population. Now, for some or a small subset of population, it might be wiser to visit the psychiatrist or the psychologist in person. But for most of what people are going through, what we refer to as the category of common mental health disorders, teleconsultation is actually a boon. It provides access to people even in the remotest parts of the country. And with the technology pervading our lives, and this is the plus side of technology, and everybody seems to have a smartphone and everybody seems to have an internet connection, so teleconsultation services are relatively easy. We've been doing these teleconsultation services at Medanta for many years now, and we found them to be quite effective. So the government just has to use or utilize this idea of teleconsultation services, let the people know that such and such consultation services are available, and it's just a matter of time before people start utilizing them. As I mentioned, the common mental health disorders are the disorders where these services work better, and there will be a set of people who will require a visit to the hospital. Both psychiatrists as well as psychologists and counseling can be provided through teleconsultation services.